leading global efforts and action in support of communicable and non-communicable.
Warm welcome. We're going to make a start. I was giving people from Committee B a little bit of extra time to make their way across the Palais. Can you hear? On this side they're having trouble? Maybe it's just your individual mic. You might want to change seats. You okay? We now drive towards universal health coverage.
Your Excellencies, ladies and gentlemen, good evening. It's a great pleasure to welcome you this evening in our side event, Disease Prevention, the Role of Primary Healthcare in Achieving Comprehensive and Sustainable Health Coverage, which comes during the 72nd World Health Assembly. I'm pleased to welcome our colleagues and partners in this event whom will share their outstanding experience in this field: the Republic of Estonia, the Sultanate of Oman, and the Republic of Turkey. I would like to point out that the Kingdom of Bahrain has given great importance to the issue of disease prevention. Primary care has played a key role in achieving the desired goals, and through our presentation, we will highlight the most important achievements in this field. I would like to introduce to you Dr. Abdul Hussein Mohsen, Consultant Family Physician, Head of Council of Al Ali Health Center, who will present the experience of the Kingdom of Bahrain, together with Dr. Mohammed Al-Sha'ban, Head of Health Policy at the Supreme Council of Health and Director of the Primary Healthcare Autonomy Project. Your Excellencies, before I conclude, I would like to express my thanks and appreciation to our colleagues for their continued support for this event, hoping that it will be of benefit to all, and we wish you a good time. Thank you.
Another important strategic thrust within this National Health Plan is the National Social Health Insurance Program. Now, this program is one of the main pillars of the National Health Plan, and it is dubbed, or we called it Sahati. Sahati in Arabic translates to my health in English, and the idea is that each person needs to take the initiative and responsibility of taking care of their own health and preventing their own disease. The objectives of this program is a focus on disease prevention as a main pillar within healthcare in Bahrain. Provider autonomy, which means a shift from the current government structure of public health hospitals to setting up autonomous health units within the public structure of the health service delivery units, which will lead to an improved quality because of an increase in competition between the different health providers, financial sustainability, again, because each service provided will be accounted for financially, so there will be a financial sustainability scheme for the years to come.
In the Kingdom of Bahrain, we provide a wide spectrum of preventive measures that includes both primary and secondary prevention. For primary prevention, we provide all the type of vaccinations that include childhood vaccination, high-risk group vaccination, traveler vaccination, and etc. Also, we provide nutritional supplementation that include, for example, supplementation of the flour with iron, with vitamin D.
Health promotion and disease prevention are an essential part of universal health coverage. That's why primary health care, with an emphasis on health promotion, disease prevention, and the determinants of health, is so important in the general program of work and the Sustainable Development Goals, which is very important for all countries, be it high, middle, or low income countries. Prevention services often get too little attention because they require persistent behavior change and conflict with commercial interests. But the impact on morbidity and mortality is huge, and the economic benefits cannot be ignored. No country can afford to treat its way to good health. All countries must invest in programs that keep people healthy and out of hospitals, because prevention is not only better than cure, it's cheaper. I thank you. Thank you, Pete.
As I found during the preparations at Bahrain and Estonia, there are very many similar things in our societies and states as starting from the population number. You have gone further, but in 2010 it was almost similar. Now we have 1.3 million people living in Estonia. We have a bit more land, but also our people are living quite long, as you, 77 years in average.
Before going to the relation between primary health care in Oman and the universal health coverage, I would like to share with you that Oman population, as you see, Oman population is almost 4.5 million, almost 55% of the population are Omanis and 45 are non-Omanis. To understand the UHC first, we need to understand what's the end users, what are the clients. Looking to this pyramid from the right one, you can see Oman is having younger populations, which make a lot of constraints and difficulties in developing programs that are targeting below 15 of age.
Discuss a little bit more, I think, in the discussion, how you managed to convince the decision makers to invest so much in the primary care level, because I think that's important for all of us to understand from these.
I just want to show you a few slides to more visualize the threat we are struggling and opportunities for action. The first two slides are prepared by the support of WHO Euro's dispersed office in Moscow, working on NCDs, and excerpt from a book published by WHO. You can see on the lower right corner the total cost, nearly 70 billion Turkish liras, calculated by using different data on 4 major NCDs, outpatient and inpatient treatment costs, and also indirect costs like not able to work days, ineffectivity in workplace, and premature deaths.
Good evening. My name is Florian Tiller. I'm working with WHO in the Service Delivery and Safety Department. First of all, I'd like.
And I think it was a wonderful presentation. We love the facts, and it's really great to invest in primary health care.
What we do in Kenya, we allocate the money to the
information, but just a general picture of how it is integrated.
Really take seriously, and I'm really particularly impressed with all the presentations that you.
So thanks again to the organizers, to Madam Minister for organizing a great session, and to all of you for coming on a Friday night. Thank you.